everyone. We are so glad to have everyone here today. We'd like to welcome all of our attendees. We have folks that have already been hired for Inova and are going through the immigration process. We have some other nurses that have just interviewed with Inova. Some of them have accepted offers in the past 7 days. And we might have some people who have an outstanding offer with Inova in their email right now, trying to decide if they should accept it or not. So we welcome everyone. We're so glad you're here. A big thank you to the team from Inova for taking time out today to talk to all of our candidates. I'd like to introduce them. So we have with us Dawn Maybin, who is the team lead for talent acquisition and really helps support the international program from talent acquisition. We also have Tasha Lasseigne, who is the program manager that supports this from Inova, and special guest, Alvin Matium, who is the clinical director for the cardiac ICU at the Fairfax Hospital campus for Inova. So thank you so much for all of your time here. Today, Inova is going to talk us through this wonderful presentation and give us some additional information about the Inova Health System. And then we're going to do some questions that we have heard from candidates that have been hired by Inova. And then we're going to talk a little bit about what to do if you have friends or family that might be interested for working at the Inova Health System. And then we're going to take your questions. So if you have questions for Inova, please feel free to put them in the chat, and you're welcome to go ahead and ask them as we go through. And then as we get to the end of the presentation, we will be able to take those for you. So I'm going to turn it over to the Inova team.
Thank you, Amy. Thank you, Amy. Yes, I am Dawn Maybin, as Amy did mention. I'm one of the team leads with Recruitment, working very closely with WorldWide HealthStaff. So I will get started with our presentation here. I'll move right on through. We have our pictures here. I'll just get started on our first slide. So let's kind of go over a little more information about Inova. We have a few fast facts for you. I'll just kind of highlight a few of them. Inova is a leading nonprofit healthcare provider in the Northern Virginia area. We have 5 main hospitals. We have 15 urgent and emergency care centers, and we have 26 primary care centers. We also have a very robust workforce of over 20,000 employees that include over 1,000 providers and over 5,900 nurses. In our next slide here, you'll see a few pictures of our facilities, the 5 main hospitals that I just mentioned a few minutes ago. We have our Alexandria Hospital that is located in Alexandria, Virginia. We have our Fairfax Hospital, that is our level 1 trauma center, that is located in Falls Church, Virginia. We have our Fair Oaks Hospital that's located in Fairfax, Virginia. We have our Loudoun Hospital, that is a level 3 trauma center that's located in Leesburg, Virginia. And we have our Mount Vernon Hospital that is also located in Alexandria, Virginia. So if you're not too familiar with Northern Virginia, our 5 main hospitals kind of spread out across the Northern Virginia area and very close to the Washington, D.C. Just to kind of go over a few of our accolades that we have achieved, we have received the U.S. News Best Regional Hospitals for the Washington metro area for 2021 and 2022. 4 of our hospitals are designated magnet facilities, so we're very proud of that. Our Mount Vernon Hospital is one of our most recent hospitals that did receive that designation, so very excited about that. All of our hospitals are fully accredited by the Joint Commission. We do have across the system, we do hold about 20 commission disease-specific certifications, so that is amazing. All of our hospitals have received a Leapfrog Hospital Safety Grade A. And critical care units from 3 of our hospitals have earned Beacon Awards. So each of our hospitals are very unique to the communities that they serve. And while we do want you to find a home with one of our hospitals, we want it to be a good fit for you and your family, as well as your personal life as well. So if you have any questions about anything specific about the hospitals at all, please feel free to let us know. And we have here, at Inova, you'll see that we have 5 core nursing values that our team really lives and breathes by. So that includes our patient always, our people, we have integrity, one team, and excellence. I won't read through all of the descriptions for each of them, so feel free to read through them if you like. But I did want to kind of share that while patients are at the core of all that we do, and we do really have a deep commitment to our people, and that means our employees, I wanted to share that I feel kind of the value that's kind of more personal to me would be excellence, I would say. I've worked with a lot of organizations, I can say that in my many years, and I've really never experienced a team that has really been more focused and more everyday focused on striving towards excellence. I've never seen it across all of the systems that I work with, so that's really kind of hits home for me. And we really can't wait for you to be a part of our excellence. So I think I will now hand things over to Tasha. She will tell you a little bit more about what else we offer our nurses and why you should come work with us. I think you're muted, Tasha.
Oh, there we go. Okay. I was like, I think she might have turned her camera off.
There she is. Can you hear me? There she is. Yes, we can hear you. You were here for a minute.
Hi, everybody. Tasha Lasseigne. Thank you, Dawn, so much for everything that you went over about Inova. I'm going to pick it off and say, you know, why Inova? Why would you want to join Inova? We have some really great things to offer at Inova. Some of the ways we do this is by focusing on your overall team member experiences. The second you become a nurse with us, you are connected to a community of nurses, a community of healthcare professionals that really make good use of your skills and abilities. We invest in our employees' training. We invest in their development. We really give you those tools that you need to grow as a nurse. Our environment, we have the state-of-the-art medical and also training facilities. In addition, we are committed to building a culture of inclusion and in the workplace. Over the last few years, we have created 11 different team member resource groups, and those groups are formed around shared characteristics of life experiences or self-belonging. So we really do things that are personalized and really help you feel connected in all different ways. And the last point that I'll mention is we enable our team members to really develop their own career path. And we want their career path to be a long-term career with us. Like, we want you to be committed. We want you to feel comfortable. We want you to feel like we are doing everything you can to help you in your career and grow along together with you. That brings me over to benefits. We definitely understand that benefits may look different depending upon where you live. So our job here is to make you familiar and help you understand everything there is to know about benefits. We have fantastic benefit package to make it super easy so you can access and really read up on everything. We've attached a QR code here, and I encourage you to take some time after the webinar to look at it. Review things. I'm going to highlight just a few that I think would be very interesting to you. We have 2 medical plans with national coverage, and that also includes dental and vision. Most of our benefits will be begin on the first of the month following your date of hire. We also include life insurance, short-term, long-term disability. We have a 401k retirement plan with a 5% matching contribution. We have paid time off that accrues at your beginning start date, 7 paid holidays, and accrual paid time off. We just implemented this summer parental leave at 100% pay, which is super exciting. That's something brand new that we're rolling out this summer. And we really focus on a lot of benefits around our education programs, like tuition reimbursement. We have student loan assistance. We have a nursing excellence scholarship program. Our dependents, if they pursue healthcare degrees, we have benefits that go along with them. So I encourage you to use the QR code to find out more about our total rewards package. Let's see if I can figure out how to get this to the next thing. All right, so your journey at Inova. This is very exciting because we have created a customized journey just for you that starts as soon as your flight is booked. We will send you a welcome email that includes everything you need to know, from our confirmation at the airport. All of our hotel locations are within 7 miles of our hospital. So we make sure that it's nice and close, easy to get to. In our welcome email, we also include benefits information. We connect you with our talent acquisition if it's needed. And then we really give you more information about our portal and benefits, and also invite you to join our International Nurse Facebook page. So once you arrive to the US, the nurses will meet our driver at the airport. We have shuttle that is arranged all for you. And our driver will take you to your hotel, and we provide up to 6 weeks paid hotel stay for you. We really think it's important for you to take the time you need to get adjusted and really settled in your new environment, to go out and explore, go out and look at the area, figure out where you want to have an apartment. Like, we really want that time to really have some downtime and to get adjusted to your new home. So 6 weeks of lodging paid is really an awesome incentive. And a lot of our nurses have been really excited about that feature. I went over the airport shuttle. You will also be assigned a buddy, and they will be reaching out to you, stay connected with you throughout the process to see if you have any information, like any questions about like your unit and that kind of stuff. We will also enroll you free of charge in a BLS class, making sure that, you know, if you need BLS, we will kindly take care of that, schedule it, let you know where to go. And then when you arrive, we also have put together a really neat Inova welcome gift that we present all of our nurses. And it's exciting. I mean, we kind of came up with it together, and everyone has had awesome feedback about it. Your start date, you will get an email the week before you start. You'll get an email about Inova New, and that is our 2-hour orientation. And then you will also have check-ins throughout those 6 weeks of stay, and also a few weeks before you come, by the program coordinator, which is me. So I really want to provide that high-level support to every single one of our nurses and really make you feel, as soon as we connect, that you are part of our Inova family. That's my goal. I'm here to help. I do anything and everything to make you feel comfortable. So that's my commitment to our international nurse program. With that being said, I want to introduce you to a leader who I think is a real champion to this program. Alvin was the first person to receive an international nurse in our program. And Alvin's going to share with you a little about his experience and career at Inova. He's been an amazing team member. So with that, Alvin, you can take it away. It's all yours.
All right. Good morning, everyone, or wherever you are in the world. Good morning, good evening, good afternoon. So my name is Alvin. I'm currently the clinical director of the cardiac ICU at the Inova Fairfax Medical Campus. We have different campuses here, and I work in the Inova Heart and Vascular Institute, where the cardiac ICU is. So my journey started 20 years ago. I am originally from the Philippines. I moved here in 2000. I was in Florida, and I worked there at a hospital. And that journey really took me, to an immense amount of opportunities, growth opportunities. But really, my journey at Inova started back in 2016. I was already, a critical care nurse, and I was looking for growth opportunities. And so it was a natural trajectory and direction to look at leadership roles, because I was really interested in becoming a nurse leader. And so Inova was, the one that gave me that opportunity to grow and develop as a nurse leader. So I became a clinical director back in 2016, and at another Inova hospital at Alexandria. And then I eventually came here at the Fairfax Medical Campus, where I currently lead a team of very energetic, very engaged, and top-notch nurses, physicians, pharmacists, and social workers, case managers. We have an amazing team here, where everybody just loves taking care of patients. We are a receiving hospital for 20 to 30 small to medium-sized hospital in the DMV. So DC, Maryland, and Virginia, for our cardiogenic shock program, our pulmonary hypertension program, our heart and lung transplant program, and also our ECMO program, where we took part of that as well. So you can see in the pictures, that was me when I was probably your age, 20 years ago, on the left upper hand corner. And I was working in nursing professional practice as well when I was in the Philippines, and I slowly transitioned into this role as well in the United States. So I highly encourage you guys to apply, look at different growth opportunities, and become who you want to be. There are different opportunities here for clinical nurses at Inova. I always encourage my nurses to become part of our different initiatives, our committees, because there's different pathways for you to grow, to advance your career, whether you want to be a clinician, an expert clinician, just like my team, they're all experts. You can be an educator, you can be a nurse leader, you can be a mentor to new nurses, and you can be a practitioner as well. So, the opportunities are really endless. And that's my team right there, and my senior director, celebrating one of our achievements when we received our magnet designation. So really testament to, the commitment, the dedication, hard work of this team. And, receiving that recognition was really an important part of our journey at Inova. So yeah, there we go. And that's what I have.
Thank you, Alvin. We appreciate you so much. So just to kind of go over, for those of you that have not interviewed with us yet and possibly are interested, wanted to let you know the areas or the units in which we are hiring our international nurses into. So we do have career opportunities in various shifts. We do hire into our critical care or our ICUs. We have ICUs in our cardiac space. We have ICUs in our neuro, trauma, med surg, We hire into our ED departments, also with our health plexus. We hire med-surg nurses, our telemetry and step-down nurses. We do hire acute inpatient rehab. We have behavioral health positions. We do hire into our women's surgical services. That is the only area for women's and children's that we are hiring into, is just women's surgical services. We have our operating room in PACU, and then we have our ICAR, cath lab, EP, and our interventional radiology, as well as our float pool. If you're not familiar with what float pool is, within our system, it is a nurse hired into our system that will float to specific specialty areas. So there could be a critical care float pool, and then there is a more of a med-surg float pool. Our critical care float pool, you will float to our critical care areas, and our med-surg float pool, you will float to med-surg and tele. So that's kind of an understanding of our float pool. And I think that ends our presentation. Thank you all for joining. I'm going to hand everything over to Amy.
Yeah, so I'm going to just go back on the slides. I think that we had the pictures covering up the QR code for the benefits. So if you were trying to get to this QR code, I'm going to leave it up for just a couple of minutes so that everybody can have access to it. Thank you so much for sharing all that really great information. I have a couple of questions that I know that I've heard from Inova nurses or nurses that have been hired by Inova that I would love to ask the Inova panel. So you talked about all of these really great reasons to work at Inova, but can each of you tell me, what is it that you love the most about working at Inova? What's your very favorite thing?
I'll start. I have a bit of a different journey, I guess, if you will. It might not be so different because I know quite a few people have done this, but I'm a bit of a boomerang Inova employee. I used to work with Inova in a previous life for almost 9 to 10 years in a different department. I did leave, kind of thought that the grass was greener, but it wasn't. So I did leave and I did come back to Inova, and I've been back again for about 4 years now. So I think what did keep me with Inova for almost 10 years and what has brought me back has always been the people. I have never worked with a more robust team. The teams that I've worked with, it's just been very collaborative. My management has always definitely cared about my progression and cared about me just as a person as a whole. So I've never had a better team that I worked with. So that's what kept me with Inova, and that is what has brought me back, and that's what's keeping me here.
It's great. What about Tasha? Tasha, I think you're on mute.
Are we here?
There we go.
Okay. Can you hear me?
Yes.
Okay. I'm going to touch on our international nurse program for a minute. I have been with Inova for 3 years. I think it's 3 years. August will be 3 years. I've worked on a ton of different projects that we kind of roll out system-wide. I have been involved with the international nurse program from the start. It has been absolutely an amazing journey for me, working with all of our international nurses. I am so passionate about this program that I am so excited to get behind my desk, check to see who I've heard from, check to see what questions they have. It's so exciting. And every single person I've worked with have been way over the top nice and just really, really interesting to work with. So I'm just kind of excited, blown away, rejuvenated. I just really am passionate about this program. And I have really enjoyed meeting each and every one of our nurses that we've hired.
That's awesome. Alvin, what about you? What's your very favorite thing about working for Inova?
I think the biggest thing for me is really the people here. My team is really amazing. I come here to work every day because of them, and because they serve the sickest of the sick patient population in our area, in our community. And I think that speaks to my passion of serving my people, and my team serving the community as well. So it kind of resonates back and forth, where we work together to serve our community, but at the same time also giving my team those resources and support so that they're successful. And I'm in full support of our international nurse recruitment program, because as an international nurse, it's important to me that an organization supports this growth trajectory for international nurses. We have a diversity, equity, and inclusion initiative here at Inova, and I think that's one of the ways to really expand on building our culture, building our workforce, and really expanding that growth opportunity, to welcome new ideas, to welcome new innovations that you guys can share to us. So yeah.
Yeah, and as somebody who's worked really closely with Inova, as we've put together this partnership and started hiring nurses, I can say that I know that Inova has been very, very thoughtful in how they're going to bring in new international nurses. They've created, and they showed you on the slide, they've created a pathway for success and for support. This is in, the Inova hospital system is in and around the Washington, D.C. area. If you had to sort of say, like, what's the closest metro area, it's in Northern Virginia. That's a really diverse area anyway. So there's lots of really great culture and diversity. But I think even given that, Inova has been really thoughtful about how to bring everyone in and making sure that they have a good partner and they have good support. So it's a great team to join. In my interactions with Inova, I've seen a lot of people who have journeys where they've been, I mean, a lot like Alvin's, where they've been at different campuses, in different places, doing different things over the course of a whole career. And there's lots of, Inova Hospital System is a great system with a lot of talented people, and that give a great high level of care. Can somebody talk about, what is there a typical career path for a nurse at Inova? What are some of the, the things that you could look forward to in terms of development as an Inova nurse?
Thank you for that question, Amy. I mean, that's a very, very good question. I think a lot of nurses, international nurses, can look forward to many, many growth opportunities. I think, first, nurses can be highly specialized. So we have different facilities here in the Northern Virginia area. So depending on what your interest is, we have a very robust professional development pathway for our nurses. So whether you want to be a clinician who specializes in neonatal ICU, or OBGYN, critical care, orthopedics, medical surgical, cardiac telemetry. If you want to take care of open heart patients or cardiogenic shock patients, there's something for everybody. And I think it's a good start to really solidify your clinical practice. Once you're here at Inova, you will discover a ton more of growth opportunities. So nurses who are at the bedside have that opportunity to become a clinical leader in the unit. So you have your clinical ladder program, where you really engage in nursing practice at the bedside, impacting those patient outcomes, and at the same time you do get compensated for the work that you do as an RN3 or RN4 clinician. You become certified in your specialty. Other nurses, pursue master's degrees to be nurse educators. They become, nurse leaders like me. They become case managers. Some of them become nurse practitioners or advanced practice providers. And these opportunities, because Inova is such a huge health system in the Northern Virginia area, we have a lot of these opportunities. It's just abound. And I can speak for myself because I have roles at Inova. And at the same time, I work with different leaders from different service lines to promote that growth opportunity. So let's say, a nurse has been here 3 years, but really very interested in pursuing a professional development career. And so I connect them to the right people at Innova because we are, a big system.
Great.
So to add to what Alvin said, I just wanted to add a few more things. At this bedside level, we also have the ability to, we have unit supervisors on our unit that you're able to move into. We also have clinical mentors. We have clinical educators. So those are some other positions that we also have that you can kind of progress and move into.
Thank you. And I saw a comment come through the chat that said somebody said they wanted to be like you, Alvin. But Inova is a great place to do that, and Alvin is a super fantastic example. But I've had the pleasure of interacting with more than one clinical director, and it's just a really common story. I've been at Inova for a long time. I've worked in different places, so it's a great place to have a long career. In the U.S. It's a great place for that. There's a couple of questions that I think we normally get about immigration that I want to speak to just briefly. So some people on this call have just received an offer and just accepted an offer to work at Inova, which is super exciting. And so what's the first step? What do you do? So the first thing is you will receive an email from your case manager, and it's going to have a list of the documents that we need to collect in order to file your I-140 documents. And the faster you get that to your case manager, the faster we'll be able to file your I-140, which gets you on the path to come into the U.S. very quickly. Inova does pay for premium processing for every single nurse candidate, so that they all will be filed with premium processing. And I will say we have seen some nurses arrive at Inova in a very quick amount of time. The normal time frame for immigration is 12 to 18 months, but we have a couple of nurses who made it in 10 months. So I think making sure that you follow all the directions that your case manager asks you to do, get your visa screen as quickly as you can, study and take your IELTS or TOEFL exam. Those things will help make the process go as quickly as possible. I know there have been some questions that have come in about nurse aides and some specific departments that Inova is hiring for. Let me just talk briefly about some of the requirements to interview for Inova. So Inova is a top health system. There are high acuity, really talented nurses that work for Inova at all the campuses that we're hiring for. Currently today, Inova is not hiring for nursing assistants or patient care techs. In order to apply at Inova, you first must have taken your NCLEX exam. That is something that does need to be already accomplished. And then you do have to have really good current clinical bedside experience. For some departments, it's 2 years. For some departments, it's more than 2 years. There's some OR requirements that need to be very specific. But if you are interested, or you think that you know somebody who you might be interested in referring, if you're already currently working at Inova, please make sure to send them over to us. I'm going to put up the information on how to send over your referrals. You can also, so a couple of things. One, you can live chat right now with a recruiter at WorldWide. If you click on this link, there's folks right now on our recruiting team that would be more than happy to talk with you. If you have questions about maybe applying for Inova, if you'd like to refer somebody to Inova, or if you have an offer for Inova and you have some questions about it, these are all really great things to chat with a recruiter about live. You can also send referrals over to recruiting@healthstaff.org, or have people go directly to apply@healthstaff.org. We do a recruiting event for Inova RNs every other month. So there's always upcoming interviews. The departments that participate might change a little bit. It's based on the needs at Inova. And I saw somebody specifically ask about NICU. We are not currently hiring for NICU positions for Inova. But if you have really specific questions about your individual experience, is it a good fit? Might you be a good fit for Inova? Please go online and apply and send us a note. And we're happy to have a recruiter connect with you and talk about your experience and talk about if it might be a really good fit. But we've got people ready to talk to you right now. So at this point, I'm gonna open it up to CJ, who is one of our moderators today, for CJ to help take us through some of the questions that have come in. And just a reminder, if you have questions, please make sure to put them in the chat or in the Q&A section. If you have questions that are specific to your individual immigration journey or to your specific job offer, the best place to go to ask those questions is directly to your case manager or to your recruiter at WorldWide. If they're very specific to your situation, they will be able to have all of your information and give you the very best answer about your individual situation. So CJ, over to you.
All right. Thanks so much, Amy. So hello, everyone. I am CJ Campos, and I'm the Applicant Engagement Manager here at WorldWide HealthStaff, and I'll be joining you today with our Q&A session. And I just want to share my experience because me and my wife also have been through all the process because my wife is a nurse, and WorldWide HealthStaff is the best thing that happened to us because they help us achieve our American dream. So it was really a smooth transition here in the US. So right now, my wife is working as an RN, and here I am working with the best, with Inova, with WorldWide HealthStaff Solutions to help you all nurses to fulfill your American dream. And I'm telling you all that you are on the right track. Okay, so we are ready to answer some questions, and I've seen a lot of good questions here. So let's start. So here's a question from Jalmon Loretta. So the question is, I am already hired by Inova and will be joining soon. My question is it possible that Inova can arrange duty for us if ever my wife will work in Inova as well? Because we have 2 kids with us. My wife is also an NCLEX passer. So,
yeah, I think, Dawn, the question is, like, would you be willing to hire family members? And I think, 2 things. One, we would be happy to arrange that through WorldWide if they were interested in going ahead and interviewing for a position prior to arrival. But after arrival, Dawn, if after these folks are settled here in the U.S., do you hire family members at Inova?
I would definitely say we welcome everyone. We want the whole family with Inova. So the answer is yes. I do know that Tasha, I'm not sure. I think this was a program we were kind of looking into as far as how we were going to handle that. But do you have a process in which you speak to after they've kind of onboarded with us to ask about family members and their ability to work with us? Do you have that?
Yes, actually, what we would do is need the family member's resume and information, and we would put them directly in touch with our talent acquisition group to look for that position that would be, perfectly fit for them. But yes, we definitely encourage more than just the nurse coming over here. We definitely encourage family members as well.
Yes, we have many positions open outside of our clinical setting. So we are more than happy to consider you for positions with us as well.
So you're saying even if there's not an NCLEX passing nurse, there could be a really great job at Inova for family members and lots of other departments. So NCLEX passing nurses are welcome, but so are lots of other people.
We will take the whole family.
That's great.
All right, awesome. That's a very good news. All right, so let's proceed to the next question. And here's a question from Ogochukwu. So he's asking, can Inova give a nurse 12-hour night shift? And is there any differential for 7 p.m. to 7 a.m. 12-hour shifts?
Yes. So with Inova, we do have kind of 3 varied shifts that we offer. We have our day shift, which is 7 a.m. to 7 p.m. We have our night shift, which is 7 p.m. to 7 a.m. So those are the straight shifts that we have, but we also offer rotation. So that is our day-night rotation. It is kind of how that rotation works does really depend on the unit, but we do have that. A lot of our higher acuity areas do typically hire more into that day-night rotation type of position, so that's what we offer. As far as shift differentials, we do have them. I can kind of go over them now, or would you like me to put them in the chat? Which one will work best?
I would say put them in the chat, Don. And if you have some specific questions, we also have the shift differentials at WorldWide. So if you would like them, reach out to your case manager, your recruiter, and we can send them to you as well.
I'd like to add also that the shift work depends on the needs of the unit. So that's a conversation that you will have with your leader when you get here as to what shifts would that be? How would that look like? And depending on how the unit operates, that's how you will do that. Yeah.
All right, awesome. Oh, okay, so here's another question from Eman. Okay, so he's asking this: would you like, or he wants to know do you recruit a research nurse?
So I think maybe I'll take that one. So I would say it's hard to say specifically. It would, there would be a bedside, like with the nurse does have to be working in current bedside today. The best way to answer that question, though, would be to send your resume over to WorldWide and connect with a recruiter. And we would be able to look at your experience and then help advise you about whether or not it would be a good clinical fit for Inova or not. There is not like a research department, like research RN department that we're hiring for. But I think the best way to know would be to have a conversation with a recruiter.
Okay, awesome. Another question from Arian Corpus. She's asking, what happens while we are waiting for our SSN? Can we start working or orientation without SSN?
That may be a Tasha question, but I don't think so. I think you don't have to have your social to apply for your nursing license in Virginia. So that's good news. But you do have to have your social to begin working, because you have to have your social security number in order to start getting paid.
Correct.
That is correct.
Okay, so I'm checking out some good questions here. Okay, so here's a question from Zuleha. She said, do you require current bedside work experience? I had to take time off for my PhD and now for NCLEX, as I cannot work and study for NCLEX exam.
Yes, this job does require current bedside experience. But hey, awesome job on your PhD and studying for your NCLEX. And then once you go back into bedside, you have Inova as a destination for you. Please let us know, and we'd be happy to connect you.
Awesome. Okay, still checking out good questions here. All right, so here's a question from Emmeline. Will there be any increase about our salary offers since our papers is still on process?
That's a great question. So I think one of the really awesome things that Inova has done is when they give you an offer, they add a year of experience to the offer that they give you, anticipating the time that you're going to be continuing to work in bedside. The salary will be reevaluated at the time of embassy interview in case there have been any compensation changes, just to make sure that you are eligible for, exactly the same salaries everybody else at Inova in your department with your level of experience. But they have done an awesome job to make sure to get you the very best salary that they can. And I think one of the things that I commend them for is making sure that everyone is paid the very same, no matter whether you're a domestic nurse or an international nurse.
All right. Okay. Nice. Next question. So it's really, we have a lot of questions here. So we are going to select the best of the best. So this one. Do you offer help in finding schools for our kids?
Oh, that's a good question. Maybe Tasha. So as part of the process, as the nurse arrives here, is there any information about local schools or public schools that is shared with the candidates?
Normally, once the nurse arrives here, we allow them 6 weeks to really kind of look into the area. Our buddy will provide any type of information that they need. I can help provide any information they need. So, we give you that time to really look out and really explore the area to see what type of schools and what type of location you want to live.
Yeah, awesome. And then we do have a lot of questions and we probably don't have time to answer all of them, but let me try to hit a couple at one time. So there's lots of questions about arriving, which is awesome. WorldWide does have a whole relocation team that works in conjunction with the Inova team. We do have, somebody asked about car loan assistance. We have a group that helps with car loan assistance. We have a group that can help with establishing a U.S. bank account. And there's just a litany of other things that our relocation team can help with. We also partner with Inova. They will work out the 6-week temporary housing part. So that gets worked out on your behalf. And it's not it's not a cash payout. It will be housing that that you would receive. And I feel like there was one other question in that group about arrival. Oh, somebody asked about why can't we book housing until we have why can't we book a flight until we have the resignation date? Because it could change. And so if we want to make sure that we are providing the right flight information to Inova, because they're going to prepare the orientation and the housing and all of those great things to make sure they're ready for your arrival. But we also need to make sure that we know when your last day is going to be working. So we get that, we have all of that planning, and it doesn't change because there's a lot of people involved in making sure that every candidate has a really great experience when they land. And then one other thing that I saw, and then I'll turn it back over to you, CJ, are the prevailing wages for Inova current? Yes, they are current. Prevailing wages for most folks will expire June 30th, but we've already refiled. So Inova should have constant prevailing wages that are always accurate.
All right, awesome. Okay, so let's proceed to our last question. And if you have more questions, don't forget to, we have the link for our live recruiters. You can send them or chat with them. They're live right now. So the last question would be from Melissa Nicole Mascardo, and this is a good question. So what is the nurse to patient ratio in Inova?
I can answer for my department. So for the CICU, cardiac ICU, we do have a 1-to-2 nurse-patient ratio or 1-to-1, depending on acuity. For the step-down units here at IHBI, The nurses there get a 1-to-3 or 1-to-4 nurse-patient ratio. Again, depending on the acuity of patients. We staff by acuity in this campus.
Yeah, and I'll just add on to that. The ratios are really based on the type of unit. So let's say a med-surg unit would have a little bit of higher ratio, so that might be 5 or 6 to 1 in our med-surg areas. Step down, as Alvin said, probably at the most, maybe 4. Step down, and then our ICUs across the board are generally 1 to 2.
All right, awesome. Thank you so much for your help. And to all folks who just hopped in right now, don't worry, we will send a replay video that'll be sent out in your email within 24 hours. So don't worry, you can watch the replay of this event.
Yeah, thank you, CJ. I want to capture some final thoughts from each of the panel members from Inova. We've heard a lot of really great things today. Inova is a great place to work. There's great opportunity for future career advancement. There's great benefits. There's, great people, I think we've heard. From each of you, what are the final thoughts that you would like to leave with this group? And maybe, what do you think is most important for an international nurse to know about Inova? Maybe let's start with Tasha.
Hey, thanks. No. My final thoughts. Life's about, making a risk and making a change. And I highly encourage you to, if you're interested and this is something that you have dreamed on doing, take it. We hope we shared that you will have a great support system here. The second you become connected with us, we can answer any question. If we don't know the answer, by all means, we will look for it. But we will never really leave you hanging. We're here for you. You'll be part of a community at Inova, and we really want to make this your home. So I encourage you to take that leap of faith and just, move forward and come join Inova.
Okay, how about Alvin?
I say if you want to come to the US and fulfill your dream of becoming the best clinician ever in the United States, go ahead and apply, take your NCLEX, the WorldWide Health Services, solutions. They provide all the information and how you can make that dream happen. And really the first step is to become a licensed nurse in the US and then apply. I mean, the possibilities are endless. I think it's important to have a clinical experience as well in the department that you're seeking, employment opportunity at. So if you want to become an ICU nurse while your, petition is in process, work as an ICU nurse in wherever country you are, and continue to hone that skill, gain knowledge, expertise. Because when you get here, it's not that different. Maybe, equipment is different. Maybe our care practices are a little different, but at the end of the day, it's really, that caring heart that you provide to your patients that makes the best difference. And being open to learn, open to grow. That will be your best bet, really. Yeah. Good luck.
Thank you. Dawn, final thoughts?
Yeah, I guess I'll just add, Inova, I know you've heard this today, but Inova is really a world-class healthcare system. So I know it sounds like we're biased because we work for Inova, but it really is. It really is a true statement. So as Alvin mentioned, the possibilities are endless with Inova. Wherever you want your career to go, we can help you to achieve that. So we welcome you all, and any questions, let us know.
Awesome. Thank you. Thank you all. A great thanks to the Inova team who's taken time out of their busy day to do this and to chat with you. I know we were not able to answer everyone's questions, so please reach out to either the recruiting team if you have not yet been assigned a case manager, or the case management team to get your questions answered. We do want to make sure that we help support all of those. Inova does have a Facebook group. I think Tasha mentioned it, for all of the nurses that have already been hired. Please make sure to join that if you've already signed an offer, and really begin to create your community in Northern Virginia early on. And thanks again to all the attendees who joined us today. We appreciate you all very much, and I hope everyone has a great rest of their day here or evening, depending on where you are in the world. Thank you all.